them so they know I'm here and I'm secure with them. Okay, you're gonna use either your soft fist. I'm gonna use my forearm. You're gonna clip right onto the top tip of the right of trochanter. We're gonna move into abduction, and we're just gonna move into adduction. Super easy. And we're gonna start warming up mid glute medium in. Now glute medium in is a mirror to pec major. Move the femur more into the middle, do the middle fibers, and move it more posterior to get the anterior fibers. So it's opposite.
Okay.
Done. Now what I don't need to see is this huge, you ready? Just let go. I've got your leg. This huge movement here to way down here. Mid-range is totally fine. See how small it is? That's perfect. This feels really good. You doing okay?
Yeah, it hurts more than I thought it would.
I know, it does. That is, whatever it says up there, probably PKM. If you see PKM and you don't know what hands, quad, TFL. There you go.
Are you just kind of like gripping your fingers a little bit in?
Yep.
Yeah.
And then as I'm moving, so I start in flexion.
Yeah.
Really compress in and finish your stroke together. Okay? Flexion to extension. Quads would be extension to flexion, correct? So you want to come around to the flexion. Now with hands and quads are quite big muscles, so sometimes what you'll notice is I'll pump through and then finish my stroke, especially if something's really tight and it's not releasing, not letting go. Pump it. Just pump it really well and go for it. Sounds awful, but there you go. And finish your stroke. You okay? Okay. And get that ladder, the vastus lateralis in there. You okay? Good. Good job. Okay, next we have the IT band. Yeah. So that is the border. Posterior, anterior is usually a little bit harder. I'm rolling over vastus there, but that's okay. You find the border, or you kind of eyeball it as much as you can. Remember, it comes down onto Gertie's tubercle down here, right? So what you want to do, we're going to do a myofascial strip on it. So we're not gonna, like, you can strip the IT band. Like if you want to go on and you want to strip on it, you want to go on that, you want to pick up, go for it. Those are lovely, in my opinion, relaxation strokes. Do they feel good? Sure, they're great to warm it all up. Go for it, but let's get a little bit more specific. So find that edge. What you're going to do, one hand is, so this hand, for me, I'm very good at doing that. If you do is pull the tissue away, and because it's pulling the tissue away, this is why I move. Not because I'm thinking about moving, it's because I'm pushing the tissue away or pulling the tissue away and up. If at any times you get stuck, just hold it there and it will release. Now what you can do is a little bit of, I'm off your edge now, but I'm just gonna keep going. You can move up and down or back and forth, and that will help release things as well. So you can work, I'm gonna move into the leg now. So the important muscles in the leg, actually the peroneals tib ant and peroneus longus. The big concern with the leg is people get cramps. And so what people will oftentimes think that it's
Tightness.
also inserting on the base of the great toe. So they have the same attachment, but they're like, what do you guys call it? So I don't have to call it both of them. Okay, so you understand both of them. If I say both, it's okay. I don't have to say both. Okay, I've had classes where they're like, what's a peroneal? And I was like, oh God, okay. So I'll go with peroneal because that's what I like to call it. Do you guys remember its actions? Or one of its big actions? Eversion. Yeah, totally. I was just showing you. I was like, come on guys, just look what I'm doing. It's a big everter. It's a big everter. So that's what it's easier to use eversion than like dorsal and plantar flexion in this one because you can be more specific. So what you're gonna do, you can strip it and do a passive kinetic mode if you want to loosen it. But what you're gonna do is continue on the fascial line and do the same technique. And peroneus is really nice because you can really feel the edges, and you're just gonna work it the same way. So you're working the edges, not the muscle body. We're going to work the edges. And that's the best part about sideline massage. Is that okay?
Yeah, it actually feels good.
Okay, good. Sorry, that was my knee. Is that you get to work the edges. When you get into the back, like working the QL and sideline is amazing. Working the neck and sideline, like levator strap, is so much more fun because you can get into the edges. Still good?
Yep.
Good. And then what I would do, go over to the opposite side of the table. Sure. So we're moving from plantar flexion to dorsiflexion.
Are you just pumping it, or are you just?
I'm just pumping it.
Yeah.
Because it's such a big muscle.
Yeah.
I could like do it all together, but it's hard.
Yeah.
And then, are we worried about any of those reflex points?
No.
Are we gonna treat the feet
Yes.
and the ankle? You're gonna love the feet and the ankle. I don't care how you treat it. Sometimes people pull up a stool, they treat it that way. I usually just stand here and treat it, but you're gonna go crazy. You're gonna work the malleoli. You're gonna just love that foot up because it feels so good to the client on the table, right? So don't ignore it because somebody told you there's reflex points that you have to be worried about. You don't. We can innervate them. We're not gonna innervate them. Don't worry about it. So work that foot. You doing okay up there?
Yep.
You're into pros. I love Michaela's like, yeah, not a problem. You're gonna be great. Don't worry. So what you're gonna do is, what was gonna be your question, Sam?
How would you work the hip adductors if you need to get in there?
I don't treat adductors. Good job. I'm just checking it along with you. If you want to always have contact with one hand as you move. Then you're gonna come across and down towards that lateral sacral edge. I'm just gonna hold this here just because I'm not over there and he's comfy. Give you this instead. Doing okay?
Yeah, feels good.
Checking in a lot with you. There you go. Okay, so let's finish up of the origin insertion. Can you guys tell me what it is?
For which month?
Glute max.
Iliac crest, posterior iliac crest, coccyx, sacrum,
Lateral
something
sacral edge, yeah.
Yeah, lateral sacral edge.
Coccyx comes down and inserts onto what?
the iliotibial band. No,
Yeah.
the ischial
Tibial.
tuberosity.
So this is a really nice place to work, especially inside on. You did great. Yeah, I can nerd. I love hips so much.
Okay.
So I can nerd out. But yes, I can definitely spend 60 minutes. Hip, leg, and then neck.
Okay.
And that would be a treatment for me.
Yeah, fair.
Ooh, as we're getting into that, so that's glute max. Next we're gonna talk about glute med, and then we're gonna do a passive kinetic mode. Some of you, Edmonton will